Hi, Dr. Karima here again, and we'll be straight away diving into another ADC practice paper scenario. A very good question, and I remember this question has been asked at least 3 to 4 times in the past 4 years, and a lot of people were confused about one subsection of this question. Now, since ADC themselves have provided the answer, it's great. But one of the sub questions is like an unmarked question because it can have two correct answers. I'll tell you why as and when we reach to it. But either ways, it's a very important question. It also reflects a good population cohort of Australia, which you are likely to receive if you're practicing there. And you should know how to tackle such cases. Not just Australia, in any country actually, when you get people who are taken care of by carers, then you should know what to do, and especially when those people have existing some medical conditions and they are on some medications and they have very compromised oral health. You need to give the best possible option for that scenario. You understand? It may not be the ideal option that dentistry wants you to opt for, but you have to kind of make the best out of that situation. So let's just go ahead for this question, and then whatever I've just said, it will hit you when we are solving this, okay? So very good question. I like this question. Ms. Rutherford is 53-year-old and is attending your practice today with her carer. Her carer. What is a carer? Carer is a nurse or some other person who's being with you throughout the day or probably the night too, and helps you remember your medications, take them, cares for you, like your physical activities, etc. That's called as a carer. For a comprehensive examination, so she came for a checkup basically. Ms. Rutherford is schizophrenic. It's a disorder. It's a problem of psychology basically. Suffers from epilepsy with less than one seizure a year. So she does have a seizure, but it's less than one a year. But you cannot rule it out that it won't happen. And psychosis, as well as having a mild intellectual disability. So this patient basically cannot be relied upon to make the best decision by herself for herself, okay? And she may not respond or speak to you like we expect a normal polite conversation. I mean, it may happen, but it may be because she's having disorders and psychosis. She may just say what she wants to say without actually comprehending what is being asked. So treat it like any other problem that the physical body has. So now you have to deal with such patients and provide them the best of the care irrespective. So Miss Rutherford is unable to provide you with a detailed medical history. Probably she doesn't remember, or she doesn't really understand what you're asking for. She doesn't know what to speak, and her carer has brought a list of her medications that she's taking. These medications prescribed by the doctor, and the carer is giving to her probably as prescribed. Now Miss Rutherford has broken tooth 1-1, the front tooth. You took a periapical radiograph of the tooth. What is the most important feature of tooth 1-1 that you should consider? Okay, so when you see such a tooth, the first thing you have to see is, can this be saved before doing anything else? If it can be saved, then only you will proceed to do other tests. But if you see it cannot be saved, it's gone straight for extraction, correct? So what is the most important feature of this tooth, or I would say any other tooth that you examine, that classifies it whether any further treatment needs to be done or not? So that depends on the restorability of the tooth. So the answer here is restorability, okay? Straight away, you don't even have to think about it. So this is the basic classification of any tooth that you examine. Pulp status, periodontal condition, mobility, patient preference, all these comes when you have decided that yes, this tooth can be saved. So looking at it, is it a root piece or is it a structure that can be saved? That will decide your further plan of action. So that is tooth restorability. Now Miss Rutherford informs you that the upper left posterior teeth are bothering her, the left side. From the radiograph, you suspect that there is an issue related to the bridge in the region surrounding tooth 24 to 27. What is the most important diagnostic test that you should perform to assess the tissue in this quadrant 2? Now this, I think, can have two correct answers. Okay. Mobility test will be done later. It's not a wrong option. But the question is asking the most important. So I can choose one. Periodontal probing, percussion test, pulp sensibility, and checking crown margins. Okay, now looking at this radiograph, checking crown margins is the last thing on my list because you see the amount of gingival recession this lady has. You can practically see the crown margins. So that is not the first step. Mobility, again, I will do it later in my assessment because it's a bridge. So even if the other teeth are intact and one is mobile, you would not actually be able to move the bridge. Okay. Percussion test. I think this is a very correct option because you can actually see a good lesion happening on that molar, right? And the root canal done on that premolar also doesn't look like great. But I understand that she has not mentioned that there is a pain history, but she says it's bothering her. So it's worthwhile to check, is the botherness there when she's biting, when you tap on it. It will give you a picture of the periapical status because you see some problem happening. So according to me, percussion test should be the right answer, but the answer key here has given periodontal probing. They want you to probe and see whether there is a pocket or not, or how much bone loss has happened. So between periodontal probing and percussion test, my personal preference would be percussion test before I actually invade her gums with the probe. But if the answer key says periodontal probing and you wish to go with this answer, you can. So according to me, B and C options both are correct here. Ms. Rutherford says she has a phobia of needles and the carer has asked if the treatment could be done under inhalation sedation, basically nitrous oxide. Some drilling going on above. What would be the most appropriate advice you should provide regarding nitrous oxide sedation for Ms. Rutherford? First of all, in patients who have psychosis, try not to give them nitrous sedation because you don't know how may they react. At any given point of time, they might just take off the mask, compromising your entire treatment and depriving them of oxygen immediately, leading to diffusion hypoxia, which is very dangerous. So I would suggest in patients with psychosis, don't give nitrous sedation. So let's see what is the appropriate advice that we can give. It is indicated as it will replace local anesthesia injections. Wrong. Nitrous oxide never replaced local anesthesia. It is contraindicated because local anesthetic injections are still required. It is not contraindicated. You will just not prefer that in this case. It should be approached with caution due to patient's psychiatric condition. Yes, it is not beneficial and treatment should be conducted under general anesthesia. Wrong. It's not like it's not beneficial. It is beneficial. But in this case, it has to be approached with caution. Okay. So option C is the correct answer. Now you determine that teeth 1, 1, 2, 5, 2, 7, the latter two being the bridge abutments, require extraction, but the remaining maxillary teeth are sound. This question again, a lot of people had doubts. So let's clarify once and for all. Considering the patient's current health status, what would be the most appropriate option to replace the extracted teeth? Considering the patient's current health status, most appropriate option, not the ideal option, most appropriate. What is the current health status? She is having psychosis and her periodontal status is not great. You can see there is like such a horrible bone loss also. Even if she did not have psychosis, considering the current health status of her bone, implant is out of question. Okay, don't go on the other medical history, just take the keywords from there. Psychosis, and the x-ray gives you the history of periodontal problem. Periodontal problem itself takes away the implant option out. Now when I come to her other medical history, which is epilepsy, my god, this drilling doesn't stop. So because she has epilepsy, and if we are going to say predict if she's having a seizure when she's actually wearing the appliance, if it is an acrylic denture and she bites too hard on it like this, it's gonna break. So if you have to give some replacement, it has to be a cobalt chrome partial denture. Implant is out of question. Resin bonded bridges are not great because you cannot give such a long span resin bonded bridge. An acrylic partial denture, I said if she has seizure, it's gonna be a problem. But a cobalt chromium partial denture is going to withstand the force of biting even if she has a seizure. So the option C is the right answer of choice. Now you understand why, correct? After completing treatment planning, you assess that Ms. Rutherford does not have the capacity to provide informed consent. From whom should this be obtained? Always legal guardian. No doubts about this. Just legal guardian. I want to say more things on how to go about the exam, but this drilling is driving me crazy right now. I don't know if this recording will have drilling noise, so it's okay. I'll just end the video here. But yes, I would say to prepare for the ADC exam part 1, solve the mocks. Okay, the mock test, we have 33 of them. Solve at least 3 times. Go through the comprehensive ADC book. I can send you a sample copy if you email me. Go through the ADC companion book, which is having all the questions from all the ADC resources. Again, I can send you a sample copy of it if you would like. And study therapeutic guidelines and infection control. Alright, so thank you so much. See you later. Bye-bye.